If you do not know where to start with exercise, if you have just returned home after breast cancer surgery, if you are scared to move, or if you're just getting ready to move, then you need a level 1 movement sequence. And that's what I've got for you today. Hey there, Marion Barnett coming to you on a Monday, and I'm coming from outside. It is absolutely gorgeous out, so I thought I'd take the last little bits of summer. Actually, it's September now, but I wanted to bring to you today a movement sequence. So this isn't one specific move. This is a sequence of moves that I want you to do in order. And the reason I put these together is so you have something that you can set up as a regular type of activity so many times a day. You can start setting a schedule of the moves that you want to do. Now, the important thing with this is it is a level 1 move. And that means this is exactly where you start. So this is something you can do right when you get home. Now, you may not feel like it, I get that, but when you are ready to move, and because I know that you should move, this is a great place to start.
All right, so I want to take you through this exercise. It's about 3 minutes long. And again, it's 3 minutes long because we have a sequence of events and I want you to do each movement 4 times. So if you're not up for that at the beginning, that's absolutely fine. You can try 1, you can try 2, and work your way up. Again, this is fantastic so you can see how you level up as you get better at the exercises. So start slowly, feel good about it, and then move on. So the first step I want to show you is my hands are at my sides. All I'm going to do now is start this here, and all I've done, first move, is just turn my palms forward. That's all I've done. So you can see palms are forward. You can also see on this left side how this hand is not as close to the body as I would like. So it's not fantastic, but we are doing those moves and we are going through, and again, movement based, and we are just rotating the back through to the sides of the body. Nice and slow, and I'm maintaining a nice neutral posture. I would like you to do this in standing if you can, just because it gives a little bit more movement for the arms to be at the sides and feel comfortable. Now the next one here, all I'm doing is working the elbows now. So up, touching the thumbs to the shoulders, coming back down to the sides. I'm going to pause it here. I am working on trying to keep the wrists and the hands as straight as I can. And again, it may not be fantastic. This is our first move. This is level 1, but I'm just bringing this to your attention as you progress. So we'll do 4 of those moves. Again, just coming up, movement based. This is fantastic again to decrease your chances of lymphedema. We want the moves in the upper extremities in all of the joints we can. So now what I'm doing, I'm bringing those thumbs up and I'm bending those wrists out. I'm bringing those into extension. Then I'm going to hold the position of rotation for the neck. So I'm doubling up here a little bit. So as I've got my elbows flexed, I've got my wrist extension, and I'm working my neck, rotating that chin over to the side. And I'm holding them both as I go through. And for the video, I just did this to a count of 10, but I wanted to make sure I was holding that and I was feeling the stretch. Neck forward, wrist back to neutral, hands back down to the side. Then I'm coming back up. Again, the pumping action and that movement, we want that repetitiveness. And again, working on that extension. And you can see there's some problems here, but I'm going to be working on it. Same thing with the rotation of the neck. We are going to the side here and we're holding that as well. So as we move through this, and that's what I'm just going to do a little bit. I'd like you to do 4 of those. And again, you'll see the full thing. And again, into the extension. What we're going to switch up now. We've got the hands up. So I'm just going to hit the play button for you. I'm now flexing those wrists and working my neck into lateral flexion. This is on an angle here, okay? That's what I'd like you to work on. And those wrists, we are bending them here, trying to keep the elbows as close to the sides as we can. So I want you to do this for each side. We're going to again bring the neck back, wrists back, arms back down to the side, elbows, wrists, neck. 3 areas that are absolutely fine for you to move. And again, get the consent of your surgeon, but these are fine. They're not in any way impacting into the incisions. We're doing this slowly, and we're doing this 4 times, or what's feasible to you, keeping that pain rating scale under a 5. So I'm going to move this forward just a little bit because there's one more move I'd like you to see. So I'm bringing my hands down 90 degrees at the elbows here. And as we're moving forward now from this position, I've got my arms in at the sides. I'm just bringing my hands together and then to the sides. I'm reaching forward, coming back to the front. So again, a fluid movement. It's a sequence. Palms together. Now you can see here, my elbows are coming out a little bit from the side. I'm getting just a bit of that shoulder abduction in there, and then sliding the elbows back. My hands, my arms are staying against the sides of my body because I don't want to stress any part. So if I can keep nice control with my hands against or my arms against the body here, then that's how I'm going to continue the movement and know exactly how I should move. So my arms here are right against my body. My fingers are together, and I'm just bringing my elbows out a little bit to the sides. Then as I bring those hands back forward, I'm staying below shoulder height as I'm moving, and then as I'm coming back, I'm going to bring my arms back down to the sides. There we go. That's your sequence.
What I'd love you to do is hit that subscribe button. I would love for you to see every week's Monday Moves with Marion, see the strategies I'm putting in place to help you level up, help you get to the next stage in your journey, and get back to all those activities you love. Any questions? Send me an email, send me a DM, and have an awesome day. Keep moving.